Hello, my name is Arthur Katona. I'm a medical doctor specializing in the field of hair restoration surgery. And I've been doing so for over 20 years now. You know, not a day goes by when we see a patient or asked about a overseas hair transplant procedure. And without exception, what we see are catastrophes over and over and over again. And what do I mean by that? Well, number one, namely, hairline design. How a hairline is created takes years of experience, and having worked on thousands of patients, that really gives you that experience so that you know how to design and draft and create a hairline that's really appropriate for a patient for today and going forward into the future. So we see disasters all the time. Hair's not positioned correctly, not angulated correctly, or allocated in very inappropriate areas, really taking advantage of a patient. And even more so, patients think that they're going to have grafts allocated here and they're mispositioned here, or vice versa. Those are just clear and regular errors that we see every day. We see catastrophes in the ways in which the donor area of the hair is utilized. In other words, the donor areas in the back here, from the sides and the back of the head, grafts are removed and ultimately placed in the front where patients would need them. And what we're seeing from overseas clinic is this area is totally destroyed and butchered, leaving the patient with very few options going forward. And if they have more hair loss, not much you can do. And that principally speaks to using instrumentation that is passé, instruments that are older, not kept up with current techniques and goals and desires of the modern day patient. This is your precious gold here, folks. This is the only place where we're harvesting hair transplant grafts. And if a clinic butchers through that, and we've heard and seen from patients, they went overseas and a 16-year-old or 18-year-old medical personnel is extracting the grafts, having been just trained in this over a course of a few weeks or a few months. That's not going to get you the result that you're looking for. Why have surgery with us here in Miami? I'm a physician who's been part of the ISHRS, the major governing body of hair restoration surgery, and I've been a member for so long and met certain professional credentials that I've become a fellow of the ISHRS, which is a special credential. And now for the third time, I'm board certified in hair restoration surgery. So I think that speaks to the experience and professionalism that we can deliver for you here in Miami. We have 2 locations here in Miami to address your needs and concerns and goals of your hair loss and achieve your hair restoration dream. So please do drop by and see us here in one of our clinics here in Miami. We'd like to show you what's possible and present hair restoration surgery at the highest professional level. So let us specifically draft a very specific plan for you addressing your hair loss goals and needs. We do very much hope to get to see you here in our clinics in Miami.